truth. Bring it on.
In this present crisis, government is not the solution to our problem. Government is the problem.
Do you want the whole truth? I don't think you're ready.
Governments don't control things. A government can't control the economy without controlling people.
It's Crane Durham's Nothing But Truth.
Well, good evening, good afternoon, wherever you are. We're glad you're here, right here on the AFR Talk Network. So good to be with you and a lot to get to. So why don't we begin with the concern over 29,000? Yeah. In just December? Signed up for Obamacare? Yeah. But aren't they concerned with the security elements? The fact that they weren't even built? Here is what we call a white hat hacker speaking to this. He's in the business of finding out holes in websites for companies that hire his company. And here's what he had to say. Roll it.
We started looking at the website when we noticed a lot of the performance issues that were happening on the site, and basically started just poking and prodding a little bit, looking at the security, and we found out that it was pretty bad all around. And there were some things that we couldn't even disclose there because they were so critical in nature to public information that we weren't even able to show at the
When you
congressional
say
hearing.
bad, I mean, what can you get at? What type of information could you get at as easily as you suggest you can?
Well, everything from hacking somebody's computer, so when you visit the website, it actually tries to hack your computer back, all the way to being able to extract email addresses, usernames, first name, last name, locations. All of those different things are available now on the website. When you develop a website, you develop it with security in mind, and it doesn't appear to have happened this time. So when they created this website, they kind of threw a lot of things together, mixed and matched a bunch of parts, and then kind of put it on the site to be used by the general public. And so when you have that type of website, it's really hard to go back and actually fix the security around it because security wasn't built into it. So it's going to take a long time to actually address. And we're talking, multiple months to, over a year to at least address some of the critical to high exposures that are on the website itself.
And understanding that is a huge problem, and the idea that it wasn't even built in is scary. Coming from David Kennedy, by the way. That was David Kennedy speaking to that issue on CNBC, courtesy of the Gateway Pundit posting it. Crane Durham's Nothing But Truth, probably on AFR Talk. So recognizing that, and then realizing if you think the law is going away anytime soon, think again. Roll it.
And my main message today is we're not going back. We're not going to betray Monica or Julia or Sam or Justine or Joanne. I mean, that seems to be the only alternative that Obamacare's critics have is, well, let's just go back to the status quo because they sure haven't presented an alternative. If you ask many of the opponents of this law what exactly they do differently, their answer seems to be, well, let's go back to the way things used to be. Just the other day, the Republican leader in the Senate was asked what benefits people without health care might see from this law, and he refused to answer, even though there are dozens in this room and tens of thousands in his own state who are already on track to benefit from it. He just repeated repeal over and over and over again. And obviously we've heard that from a lot of folks on that side of the aisle. Look, I've always said I will work with anybody to implement and improve this law effectively. You got good ideas? Bring them to me. Let's go. But we're not repealing it as long as I'm president. I want everybody to be clear about that.
That's right. It's not going anywhere. So what does Paul Howard, Dr. Paul Howard, Ph.D., Manhattan Institute's senior fellow and director of the Manhattan Institute's Center for Medical Progress, who addresses the rhetoric and reality and makes it easy and digestible where even talk show hosts can understand, even Crane Durham can. He thinks he can. What are we to do? Dr. Howard, welcome back.
My pleasure. Thanks for having me on.
What do you think of President Obama making the statement, hey, this law is not going anywhere, and we're seeing some success here?
Well, it depends on how you define success. I mean, I think as a practical matter, the president's basically right. look, even if the Republicans win the Senate next year and pick up 50 seats, they're not going to pick up 60 seats, which you'd need to get past a presidential veto. So they have to hold the House, take the Senate, and then still they're going to confront, President Obama. And when the reality that money is going to keep flowing through the law, it's entitlement money right now, which means that even if the government shuts down, those dollars keep flowing through the exchanges. That's the reality that you've got to keep grappling with as a critic of the law. On the other hand, I'd say, look, the law is going to continue to have problems. A functioning website is the tip of the iceberg that are the problems that are going to be associated with this healthcare law.
Can we look at, real quick, not to interrupt, hopefully to interject, because I want to stick to the website just for now, because I realize it's the tip of the iceberg. I've read your work, my friend. Bottom line, I look at statements that we get from a white hat hacker whose business it is to understand and evaluate websites and says the security wasn't built in. I also hear David Plouffe make this statement Sunday on This Week. Roll it.
The program was designed to be implemented by the states, and in most of the states that are running their exchanges, it's going quite well. You talked about Medicaid expansion. I think it's just a fact, and it may take till 2017 when this president leaves office. You're going to see almost every state in this country running their own exchanges eventually and expanding Medicaid, and I think it'll work really well then.
That's 2017.
Okay, so he goes to the Medicaid aspect, which you focused in on. Please start at the website. Did they intentionally have it set up where you couldn't see the prices without the subsidies if you qualified for them? And with the security, is it possible? I mean, the white hacker makes the statement, but he says there was no security involved. Were they that inept? Was this inept, or was there a plan here with the website?
Right. Now, for your first point about seeing the prices, so a decision, they went back and forth on this, but I think it was the Washington Post to report this, maybe it was the Times, New York Times. They made a decision late in August not to allow people to see prices before they purchased policies because they wanted people not to go through sticker shock. You'd say, oh my God, prices have gone up. The subsidies will, of course, if you're getting a subsidy, if you benefit, they'll take some of that sticker shock away, but probably not all of it. Unless you're, really at the low-income end of the spectrum. So that was a decision that they made that contributed to the website's problems. But the other thing that you point out is, look, and I can make a couple of points there. First of all, you're absolutely right. There's no end-to-end security testing of the product. It was congressional testimony by security experts before Thanksgiving, where 3 out of the 4 experts who testified said, security remained a concern, that they would shut the website down until they could really validate all the security issues. That's going to remain a problem. How much of a problem it's going to be, we're not going to find out until there's a massive, or if there's a massive security problem with the website. And then as far as Medicaid, is concerned, obviously, tremendous access problems with Medicaid, good insurance on paper, but lots of doctors don't accept it. And that's going to be a real problem, especially because it's already bankrupting the states in terms of the amount of money that's flowing from state coffers into the Medicaid program.
All right. Now we'll go to the general, which we'll come back to the Medicaid discussion as well, I think, because we can't stop addressing that, seeing maybe what inevitably comes out of the law and as it develops, as you've mentioned. Here is President Obama making the statement that the law is working. It is working. Not 2017. No, it's working right now. Roll it.
I've acknowledged more than once that we didn't roll out parts of this law as well as we sure should have. But the law's already working in major ways that benefit millions of Americans right now, even as we've begun to slow the rise in healthcare costs, which is good for family budgets, good for federal and state budgets, and good for the budgets of businesses, small and large. So this law is going to work. And for the sake of our economic security, it needs to work.
All right. So he says this law is going to work. It's already working, pointing to the people that have gained. And I guess the question is, structurally, can it actually, quote, work? Right.
Look, I mean, expanding Medicaid, is that your definition of working, that we're going to put somewhere between 15 and 20 million more people, depending on how many states expand, into a broken Medicaid program where we know has worse outcomes than private insurance, leaves people without access to critical health care? I don't think of that as a success. Health insurance costs are going to go up. We're going to be forcing people to buy, especially young, healthy people, to buy policies that are more extensive and expensive than they would have purchased otherwise. And then, to get to the point of the website, the president's setting a very low bar here. So the website's getting more traffic, but the administration is not yet telling us how many people are enrolling and have actually paid for insurance. This is a point. So if they say 100,000 people have chosen a plan, that doesn't mean that they've paid for it. If you've ever gone to Amazon and put something in your cart and not purchased it, you know that this happens all the time. And that means that the actual number of people who are going to be covered by the law, we do not know, and we're not going to know for a long time. So I'd question that, that in terms of declaring a success. And as far as, the slowdown in healthcare costs, I'd say, that actually began before this president took office. It began during the recession. Costs have stayed down largely because of economic factors. So, that's really the biggest story behind the slowdown, that and the switch to more high-deductible health plans, certainly not the law, which, hasn't even gone into effect yet.
Okay, and you said, opening that statement, you said Medicaid leaves people without access to critical care. What do you mean?
Well, I mean that it pays doctors, basically half of what private insurance pays, even a fraction of what Medicare pays. So a lot of physicians, 30% of physicians across the country, will not accept new Medicaid patients. And if you look at the policies that are bronze and even some silver plans on the exchanges, a lot of these new plans that are going to be on the exchanges are offering rates that are just above Medicaid rates, so between Medicaid and Medicare rates, and having very narrow networks. Now, I have nothing against a narrow network, but if you're going to be offering a low payment to physicians, a lot of them are not going to take it. You can wind up pushing lots of people into health insurance designs, health insurance plans, where there are not going to be enough physicians to meet the demand, and there's going to be wait lines. So all of these are kind of follow-on problems. Again, you and I talked about the website's got lots of problems. It continues to have problems. But these other issues are going to be, the slow bleed of stories that are going to keep dogging the president and claims that, quote unquote, it's working. Are people going to have coverage? Sure, on paper. Are there going to be problems that we're going to have to deal with for, months and years to come? Absolutely.
How fast will these problems develop? You talked about the president. I'm assuming that he will be experiencing these problems not only attributed to the website or things that are a part of the website, but the doctors leaving. And I get the idea is, and I'm not a cynic, but I go, if somebody wants to get a government program going, hey, they'll wait for the consequence. They'll pay for it later. It's like all of us. I mean, so many times that our fleshly desire, boom, I'll pay for it now, or I'll buy it now and pay for it later. Is the bill coming due? Are the consequences going to be coming in the realm of doctors leaving the profession, the long-term, the slow bleed, if you will? Will they be hitting us quicker than what the administration thought and supporters would thought they would come?
Right. So the U.S. already had a doctor shortage. I expect that Obamacare is going to aggravate that shortage because we're adding more people to the system that's already strained, doing very little to alleviate that problem. And also, as you and I just spoke about, the networks are going to be very low paying, which is going to leave a lot more doctors to say, look, I'm going to stop accepting insurance, or I'm not going to accept this kind of insurance, leaving people with fewer options even if they have insurance on paper. That's a story that I think is going to play out starting January 1. We're going to start hearing about people who bought plans, who take longer to see a doctor, who wind up with complications, or if they have to go out of network in one of these narrow networks, there are no caps on out-of-pocket costs. I expect to see more stories about that, of people being left with large medical bills because their doctor or their hospital they needed to see wasn't in network. Those kind of stories are going to crop up. So this is really kind of a problem that's going to be something that not just this Congress and this president, but future Congresses and future presidents are going to have to just keep going back to. The president said, I'm willing to fix this. I'm willing to open it up. You've got to really open up the hood and get under and get into it. You may not be switching out the whole car, but you're certainly going to have to go after that engine block and get a lot of changes there.
Okay, and next week I'd like to have you on at the exact same time about the solutions that you've offered and talked about. But final question, seniors are being hurt by this law. Real quick, 30 seconds, tell me, is that true and how?
$700 billion cut out of Medicare. Medicare Advantage plans are going to be cut quite a bit starting this year. So I expect a lot of those Medicare Advantage plans, 28% of seniors are going to see fewer doctors, fewer benefits, really feel the pinch this year. So I think seniors, come November, are going to be very angry.
You are a rock star in the way you handle this and the way you address it and the way you communicate it. And that's a compliment in the good form of the rock star, not the, we all just want to be rock stars. Paul Howard, Dr. Paul Howard, it is a pleasure as always, and I learned so much. Thank you so much, my friend.
My pleasure. Thank you. Take care.
Take care. All right. Crane Durham's nothing but truth. What did you mean, Rox? I'll explain. On the flip side, a lot of your phone calls, income inequality. Do you care? Crane Durham's nothing but truth. AFR Talk.